Good afternoon. I'm Deena Mansour, Executive Director of the Maureen and Mike Mansfield Center, and I'm pleased to welcome you to our Spring 2021 Dialogues, the Pandemic Dialogues, in the run-up to our Mansfield lecture with Dr. Fauci on February 17th. This event is being recorded by Missoula Community Access Television as part of their media assistance grants programs to nonprofit organizations. They'll be showing this program again live on MCAT, and you'll also be able to see a copy of this recording on the Mansfield Center website, as well as on our Facebook page. The Mansfield Center was endowed by an act of Congress in 1983 to carry forward Senator Mike Mansfield's legacy of statesmanship, ethics, and civility in public affairs. The center's mission is to foster a national dialogue of respect and civility and to restore trust in our national institutions, our founding documents, and our public policymakers. Our dialogues, like the one today, are designed to foster civil exchanges of ideas from diverse viewpoints, reinforce the importance of democratic institutions, and examine the role that ethical values play in public life. We hope that you'll join us in making this a true dialogue. Our speakers will share their backgrounds and expertise for the first 40 minutes, but the final 20 minutes will be integrating your comments and questions. So you each have access to the Q&A box. So we encourage you to comment and question throughout the presentations. So I'm pleased to introduce our speakers today, all from the School of Public and Community Health here at the University of Montana. Of course, the university's mandate, given our public engagement, the support of your taxpayer dollars, is to support the people of Montana. And that's what the faculty and students at the school do so well. Dr. Tony Ward is a professor and chair of the School of Public and Community Health, and he has been on the forefront of supporting COVID-19 mitigation efforts. He is joined by a number of his colleagues from the school, including Dr. Aaron Landguth, Dr. Aaron Simmons, postdoctoral fellow Ethan Walker, and Deshane Barnett, who is a PhD student, but also the executive director of the All Nations Health Center located here in Missoula. So to maximize the time that we have together with them, I won't go into great detail in their bios. They are listed on our website, and it is a tremendous honor to have each of them share their expertise with us today. So I'm going to turn it over first to our first speaker today, who will be Dr. Aaron Simmons. Aaron, thanks for joining us.
All right, can you see my slides there?
Yeah. Perfect.
Great. Thank you very much, Deena, for the introduction and providing us with the opportunity to share some of the work we're doing to assist in the response to COVID-19. It's really a privilege to work with my colleagues and partners in the public health community here in Missoula and across the state. I'm going to focus in particular on introducing our work in Missoula County, but you will hear in the excellent presentations to follow more details on additional local efforts and efforts at the state level. And so I'm going to start by introducing the formal partnership that the School of Public and Community Health Sciences has with the Missoula City County Health Department. So together we have an academic health department, which is kind of like the public health version of a teaching hospital in medicine. It was established in the fall of 2019, and it grew out of the vision of Missoula City County Health Department Director Ellen Leahy and Dr. Tony Ward, chair of our department. It's the only academic health department in Montana, and its mission centers on education and training of Montana's public health workforce. Specifically, public health, our health department professionals serve as site mentors and advisors to public health students, and faculty members contribute as instructors and academic advisors to health department professionals and practice. And we have multiple research projects that leverage the academic health department, including a study on wildfire smoke exposure, as well as the Invest Health effort, which is aimed at improving health in lower wealth neighborhoods in Missoula. But in March of 2020 enters COVID-19, and it's been really helpful to have an already established platform for partnership during the pandemic. And so this partnership has manifested itself in really concrete ways since last March, with members of our school playing an active role in the actual incident command structure in the Missoula County COVID-19 response. And we sit in the plans section as part of incident command. And just before I move on, I just want to note that multiple current students and alums of the School of Public and Community Health Sciences play key roles in this incident command structure, including Cindy Farr, who's incident commander and a current student in our program. So postdoctoral researcher Ethan Walker, Professor Curtis Noonan, and I make up the EPI unit under the plan section. And so our EPI unit, the epidemiology unit, provides weekly updates to the incident command leadership on current trends in the pandemic. And just to provide you with some examples of how the data are used, Cindy Farr, incident commander, uses the data in twice weekly briefings. Maybe you've seen them on YouTube. Health officer Ellen Leahy uses the data and data interpretations with elected officials every single week and monthly at health board meetings, as well as at school board meetings and with multiple business groups. And so this really helps ensure that decision-making groups in Missoula County have access to the latest epidemiologic data to inform their decisions. You know, of course, the health department, they certainly have the expertise to work with these data and to do this work, but our assistance with the epidemiologic analyses frees more of their time for the urgent public health response efforts. And our efforts at the county level overlap substantially with more local and state level efforts. So for example, Ethan Walker works closely with Aaron Landis, who collaborates with the Montana Department of Public Health and Human Services to project COVID-related outcomes in the state. Curtis Noonan is on the EPI unit with Ethan and I, and as well as the University of Montana's COVID response team. Elizabeth Williams, a doctoral student in our public health program and an epidemiologist with Missoula's All Nations Health Center, joins our regular EPI unit meetings. And so these collaborations allow for a bidirectional flow of information, all with this overall goal of providing assistance in the public health response to protect the health of Montanans. And so now I'll pass the presentation to Deshane Barnett, a doctoral student in our program, who is playing a critical role in the local response efforts.
Great, thank you so much. I'm going to my presentation up and rolling. So good afternoon, everyone. My name is Deshane Barnett, and I am the Executive Director of All Nations Health Center and also a PhD student here in the School of Public and Community Health Sciences, and talking about how the epidemiological data that we're going to be talking about today actually informs our response here within the Missoula Native American community. So All Nations Health Center, we get data from several different sources at several different levels. At the federal level, the Indian Health Service is providing us, weekly, sometimes daily, with data updates, incidence rates, et cetera, from throughout the entire United States, specific to the American Indian community. And we use that as one segment of data to inform our efforts. At the state level, the Montana Department of Public Health and Human Services is also publishing data largely on a daily basis. We access that data regularly through our epidemiologist, who Dr. Simmons mentioned is Elizabeth Williams. And then we also are working at the county level, the local level, with the Missoula Board of Health and that partnership that Dr. Simmons talked about, and sharing data about what is happening here in Missoula County. And we take all three strata of those data and use those to inform our response efforts for the Native American community living here in Missoula. And so basically the process is translating that evidence into action. And we could not do that without the evidence, the data that's provided to us through the epidemiological research process. And then what we do is we take that data and we translate it into how it's going to have the greatest impact for the community that we serve. So for example, we know that wearing masks is an important step in reducing the transmission of COVID-19. That has been shown in the data. What we see though is that in order to have that message be effective for the community that we serve, they need to see it in a way that is relatable to them. And so we work with other organizations to create culturally targeted health education and health information materials that support the work that needs to be done based on the data that's available. So we know here in Montana that Native Americans are disproportionately impacted by COVID-19. Estimates of about 6 to 7% of the total population, 30% of COVID-19 mortality. It is essential that we have access to that data, that we understand what's going on, but then that we translate that to an actionable format. And so we use culturally targeted materials, and we know that representation matters. As you know, our patients, our Native American clients living in and around Missoula are bombarded with health information, seeing that this information includes people who look like them, people who participate in the types of activities that they participate in. It's going to make it relatable to the point where they're going to want to pay attention. And by paying attention, they're going to hear a message that they might miss out on otherwise. Another important aspect to our community is that, you know, Native American populations in general are communal, not individualistic. And so emphasizing personal benefits, you know, you won't get sick, isn't going to have as much of an impact as saying you are going to help keep our children and our elders from getting sick. And we use the data to inform those efforts. We know that American Indian elders are being impacted by COVID at a significantly higher rate than non-natives. And so using that as an impetus to promote those health behaviors, and all of that is reliant upon us getting that data from, you know, federal, state, and local level, but really, you know, at the county level, and the work that we're doing with UM and the Missoula City County Health Department, informing those efforts. And so I know that we have several presenters today who are going to talk about what that data is, and so we just wanted to give a snapshot of how we actually use that data to address health disparities here in Missoula. For more information on All Nations Health Center, please visit www.allnations.health. And I will pass it along to our next presenter.
All right, thanks to Shane. Thanks for that important message. And thanks everyone for joining today as well. And hopefully you can see my screen okay at this point. As Dr. Simmons said a few minutes earlier, my name is Ethan Walker. I'm a postdoctoral researcher at UM. I've been involved with both the Missoula County and the state efforts to slow the pandemic. My role has primarily been in a data analysis position, so I'll kind of talk through what I've been working on. With Missoula County, I've analyzed and presented data for discussions in weekly meetings, and with leadership at Missoula City County Health Department. And then as Aaron described, they then use those figures for other meetings with leadership throughout the county. So the figures I'm presenting today have been some of the most important ones in our discussions over the past few months. So this first figure is an epidemic curve, and this is the foundation of outbreak investigation, really. The epidemic curve, or Epi curve, it shows the number of cases that have occurred on each date since the beginning of the pandemic. And along the plot, I've tried to highlight key dates so that we can observe trends in the cases before and after the dates to see if holidays or things like countywide interventions have potentially impacted the outbreak. Now, as we look across this epicurve, it appears that some of the countywide shelter-in-place orders were effective in slowing the virus in the spring, and numbers stayed relatively low over the summer. However, once we got into the fall, after the semester started and got past Labor Day, we really saw this dramatic increase in cases that this figure highlights. This lasted through most of November, and we've seen a small decrease over the holidays with a recent uptick in cases across the county. So we'll be keeping an eye on this to see where we go next. Another important part of our discussion has been highlighting cases within different age groups at the Missoula County population. So this figure is a little bit busy, but what we're looking at is each of the lines represent an age group of the population in Missoula County. So specifically, we're looking at incidence rates here by age group, and it's per week since the beginning of September. And this figure, what it allows us to do is look at trends in the incidence rates over time, and then identify which age groups are being impacted most at specific points in time. And this is helpful in just looking at recent trends and upticks within age groups. So it's really been the 20s through 50-year-old age groups that have had the most consistently high incidence rates, although the 80+ age group has also seen their fair share of increases throughout the fall and winter. Similar to the previous figure, this one is looking at incidence for age groups per week, but with a focus on school age and college age kids and students. So we can use this to track the incidence of COVID over time in these younger age groups, and it helps us observe increases or decreases in cases following important events like the start of a new semester or when younger kids go back to school after the holidays. Among these younger age groups, kids with that are less than high school age have consistently had the lowest incidence in the county. So another important tool that has evolved throughout the pandemic has been a dashboard that highlights data and analysis at a state and county level across Montana. This dashboard was originally developed by Dr. Landguth and others at UM and to display results from modeling projects for the state of Montana. Dr. Landguth will discuss these models and the results next. And the dashboard is also expanded to include various other analyses and data for the state. So this figure that we're looking at here shows the average number of new cases and the incidence rate reported over the past week. And I've highlighted Missoula County here. We've had an average of around 40 cases per day with an incidence rate of around 35 per 100,000 people over the past week. On the dashboard, this map is actually interactive, so you can hover over specific counties and compare cases and incidence rates across the state. So another key analysis that we've worked on at the state and county levels has been calculating reproduction numbers, or R numbers. And this number shows how many people on average are infected from a single infected individual. So we primarily report effective R numbers, which are the R numbers for a particular point in time. These effective R numbers are not only important by themselves as indicators for the spread of the virus, but they're also drivers of the COVID models that Dr. Landguth will describe shortly. To calculate these, we need really two key pieces of information. We need the daily case numbers for the location of interest. That data is pretty easy to gather, but we also need a more difficult number to find called a serial interval, which is on average the time between symptom onset of the primary cases and the secondary cases which they infect. And so we worked with collaborators from the state health department to calculate Montana specific serial intervals to use in our calculation of the R numbers. And we interestingly found that the serial interval in Montana is largely aligned with the COVID serial interval in other parts of the world, in spite of our more rural population here. So we currently have a manuscript under review that's describing these findings. So when we're using the case data and the serial interval from Montana, we can calculate these R numbers and then load them to the dashboard in these interactive figures. So this image is an interactive plot of the effective R number and then the confidence intervals for those numbers for the state of Montana. And these are updated twice weekly on our dashboard. We also have similar plots for the 5 different health regions in the state, and then the various counties that have high case numbers as well. Now, to interpret this, keep in mind that reproduction numbers are always positive numbers. The key threshold for the R numbers is 1. So I've highlighted that number with the red line in this figure. Now, if R is less than 1, the virus transmission is slowing, whereas if R is greater than 1, the transmission is increasing, and the higher numbers indicate higher rates of transmission. As cases dropped some over the holidays, we did see the R numbers go down below 1 a little bit, and indicating that the spread of COVID was slowing. However, we're currently seeing cases uptick a little bit since after the holidays, and that R number is once again hovering around 1, indicating transmission is on the rise. Now, this next slide is also showing the R number for Missoula County, which is currently above 1. And again, this is specifically for Missoula County, whereas the previous slide was for the state of Montana. So we'll be keeping an eye on these important figures and trends throughout the spring, and as vaccination administration really starts to ramp up. So to finish up here, overall, we're trying to highlight that we're using data and science to help with local and state leaders during this difficult and very complex time. I've been working with data from Missoula City County Health Department to develop figures that are then used in countywide meetings. And then I've also worked with data at the state level to update, improve our dashboard, and to calculate these R numbers that are used across the state and in the COVID modeling project. So with that, I'm going to let Dr. Landguth take over and discuss more about this dashboard and the COVID modeling that she's been working on. So thank you.
Great. Thank you, Ethan. Hopefully everybody can see my slides. Okay, I'll assume so. So thanks again, Ethan. And that's a nice transition into this next section. Hold on, I just want to make sure. Looks good. Thanks, Randy. First, I would like to acknowledge the team that has put a ton of work into this, including Ethan, Aaron Simmons, Curtis, Noonan, as well as our collaborators at the state, epidemiologist Isaiah Reed and state epidemiologist Laura Williamson. So next, I'd like to provide a brief background with how we started to model for the state and with context through our Montana epidemic. So our center, CFAR, acronymed and pronounced, started up in early spring. And in early March, Montana sees its first case. And we quickly realized that national models were not working well for projections for Montana's small case numbers, population sizes, density, and dynamics. And so we, specifically our director, Curtis Noonan, contacts DPHHS mid-March offering help, and a day later we start developing our Montana-specific model, meeting weekly with the state. And so our modeling group started with identifying these basic research questions. And so back in March and throughout our different waves, influenced by global and national concerns going on at the time, hospital resource use and epidemic peak rose to the top. And so we also wanted to know what transmission would look like in the state. Montana is very different than New York City. So what could we expect this epidemic to look like in the different communities throughout our state? So we continued updating our model as data and new information on the disease would unfold, summarizing our results for the governor's COVID-19 task force. But we never saw our spring hospital surge, and our model mostly went idle. But as cases started to pick up in the summer, we began holding our breath, and the model's need really emerged again in the fall. So in September, we start experiencing exponential growth again, and in October, hospitals start filling up. In October, we experienced 5,000 on average new reported cases each week. In November, we hit around 7,000. Our model came back into need as again, we are asking the questions about the demand on our healthcare resources and system. Then It is very typical to see declines in numbers even in flu cases around the holidays, but it is safe to say that Montana is past its, if you want to call it, second wave, and we are now in a second phase of our modeling efforts as well. So a whole new set of questions are on the table. Of course, some of these we don't have control over, but still of interest from these models' perspectives. We now are interested in scenarios in which the vaccine is present in the population. And looking long-term, how can models help inform the immunity landscape? And will we be living with SARS-CoV-2 forever? Before I get into some modeling, I want to make a comment and remind us all that indeed all models are wrong, but sometimes they can be useful. So much of the public first learned about epidemiological modeling during the early months of the COVID-19 pandemic. The first models resulted in more confusion than clarity. We all got bombarded with too much modeling, I know, so I will not bore you with a ton of projection scenarios. I will end this section with a few modeling take-homes that are relevant for our phase 2 modeling questions around immunity and vaccinations. So first, I wanted to show you the 2 projections that we have going for Montana. Montana's 5 health regions shown here in the map and counties. So we project forward Montana's current trend. And recall Ethan spoke about these R values. Those are exactly what we use. This black line is very dynamic and will respond to whatever Montana's current R value is, or possible sudden behaviors Montana's might be doing. For example, will we have a bunch of spring weddings? Will everyone start going to the bars, reduce mask wearing? All of this will influence the R value and thus our current trend values. Right now, we are hovering around that 1. And so we are seeing this long decay plateau out through the spring. The blue line is a scenario that basically assumes today we would all stay home and go back to the shelter-in-place transmission levels, which were very low back then in March and April. And here you see we would stomp out the infections here in Montana pretty quickly. Then the sobering task has been to project deaths. And so good news is based on our projected low levels of infections through the spring, deaths are plateauing as well, but still accumulating to a number that is too high. The next slide provides a gut check with a national IHME model, showing that our model falls within the same bounds as theirs. I will also point out that the IHME plots vaccine rollout projections and universal mask projections. Vaccines will absolutely help us, but wearing masks and social distancing on top of this are still the best scenarios. And I will also remind us that these are only models and they are not predicting what will happen with new strains emerging or how Montanans will behave, like increasing social contacts. So there are still a lot of unknowns this spring. Montanans' current mask use is around 68%. And this map shows you how we sit in relation with the rest of the states. Universal mask wearing target is 95% of the population. And finally, I'd like to illustrate how models and science can help us understand piece by piece specific interventions and while the vaccine is still being rolled out. Here is a basic SEIR model that we use to model COVID-19 disease dynamics, illustrated in an individual-based spatial model on the right. Individuals are first light gray and susceptible, come into contact with an infected person and become exposed. Then after some time, symptoms will show, and finally after some time, an individual recovers or dies. Now, more complicated models of SARS-CoV-2 are out there, and we'll have more compartments here for pre-symptomatic, asymptomatic, mild, or severe infections, but we will stay simple. There are 3 things as individuals we can do to help with mitigating the spread of a disease and thus seeing less deaths. The first is isolating, or specifically, we can add in another compartment for Q or quarantining. Here, it is important that we are able to quickly find the infected individuals and isolate them, and furthermore, that they adhere to this. The second is with social distancing, by reducing our number of contacts with others and by reducing our travel. The third is reduced transmission, like with mask wearing. Now, to illustrate the effect of these 3 NPIs, I'll have you watch the graph on the bottom, monitoring the number of infections in red. First, we run a baseline model out to give us a benchmark. Then let's test the effect of isolating every symptomatic individual. So we turn up these two knobs and we hit play. And so this does not stomp out the disease. Why? Because this illustrates how much of the disease is being spread by those that are not showing symptoms, making this a difficult virus that is extremely hard to get under control. Now let's turn quarantining back off and start implementing social distancing by reducing our number of contacts and essentially staying home by reducing our travel radius. And hitting play. So you see that the social distancing actions have a dramatic effect on reducing the number of infections. But we are long past any of these very strict stay-at-home scenarios, so let's test the effect of wearing more masks. So let's increase our social distancing parameters back up again, increasing our contacts and travel radius back up. And then wearing masks has been shown to reduce transmission by 30% or more. So let's reduce the transmission rate down and hit play again. And we see reducing the transmission also has a dramatic effect on the number of infections. And so in reality, we are somewhere in between quickly isolating the infected as fast as contact tracers can work, and they may or may not adhere to quarantining. Our social distancing is starting to loosen due to pandemic fatigue, and mask use is nowhere near the 95% universal use mark. So in summary, we are still using models, and many of these vaccine rollout plans have been informed by models. And finally, one of the biggest take-homes from the models for the spring is illustrated by Jeff Shaman's group at Columbia University in these figures. The longer we keep our NPIs in place, or non-pharmaceutical interventions, which are essentially mask wearing, social distancing practices, and contact tracing efforts, the better off we'll be. Oh, and lastly, I'll put a plug in. If these simulations piqued your interest at all, I would highly recommend checking out tonight's event from 5 to 7, hosted by UM's Department of Public Administration and Policy, and you could play your own pandemic simulations and implement your own strategies. So with that, I will pass it now over to Dr. Tony Ward.
Thanks, Aaron. So I'm going to wrap up this presentation by talking about how our school is supporting the public health workforce across the state of Montana. And our just to provide some context, at our school, we have two different programs that are online programs. So we have a 12 credit certificate of public health, and then we have a 42 credit Masters of Public Health program. Both of these are online. And the students that are in these programs are actually typically working full-time public health professionals across the state. We have nurses that are in healthcare that participate in these two programs, and as a result, we have a pretty good feel for kind of what they're dealing with, because we talk to them not only as our students but also as colleagues. Oftentimes throughout the state, there are students, but they're also people that we work with across the state. And when the pandemic hit in March of last year, many of us were teaching classes, and we had a lot of these folks in our classes, and pretty quickly we realized the stress and just the uncertainty and anxiety that these folks were dealing with, as we were heading into the beginning of the pandemic in March. So there's the state health department, or you've heard DPHHS a few times already, but the state health department is responsible for protecting the health of Montanans. But there's also 51 local health departments across the state of Montana. Some of them are fairly large, like Missoula County or Gallatin County, but some of them are pretty small and only have a couple of people serving entire counties, like what we see in eastern part of Montana. And then there's also 7 individual tribal health departments. And fast forward to summer, and beginning with the pandemic, and then going into summer, going through the stay-at-home orders and the mitigation strategies that the health departments were starting to communicate to the communities throughout the state. we started seeing signs of pushback from community members sometimes, and the, the public health workforce was all of a sudden, going beyond just trying to communicate best practices and messaging like wear a mask and social distancing, wash your hands. But all of a sudden that was being challenged by community members. And as a result, things got kind of complicated and led to where we are today. But I wanted to highlight just a couple of news stories just very recently that came out. This is the Great Falls Tribune in November 4th, 2020. The title of the article, entire Pondera County Health Department staff resigns, citing lack of COVID-19 support. So it's a fairly small county, but all four of the health department staff quit because they were just under tremendous pressure and pushback from the community. They cited being overworked, barriers to hiring help, lack of support from the county commission, and poor pay as factors. Just a couple of days later, there was a news article that came out from the Independent Record. Lewis and Clark County health officials overwhelmed by COVID caseloads. A couple days later, Billings Gazette. This is a marathon. Rural health departments struggle under weight of pandemic. So I pulled out a couple of pieces of that article, and it kind of highlights just the state of where we are as the public health workforce. One of the folks in Macomb County, which is the far eastern side of Montana, they worked every single day from March 11th until October 28th. Then she finally took some time off for her mental health. One quote from the article said, "I don't think that any public health nurse or director thought when this happened, we'd have the pushback that we've had." And then the author of the article at the very end said, several people working in public health offices across eastern Montana declined interviews for this article because they feared exacerbating the backlash they've received. Then the last one that I'd like to highlight. So this is a Montana Public Radio piece that came out on December 14th. And then there's also the text of it available at the bottom website. And just a couple of things that I pulled out from that article. More Montana public health workers are quitting their jobs as they face mounting stress and in some cases threats because of their work during the pandemic. 9 leaders of city and county public health departments have quit their jobs since the start of the pandemic. So this is not the entire workforce. These are the leaders of health departments that have had to quit because of a backlash from community members and other factors. And then this last quote really resonated with me. I've never experienced such daily hate mail and phone calls. So, of course, again, these are our students, these are our colleagues across the state that are dealing with this, and their mission is to protect the health of our communities. So one thing that we strive to do was figure out how can we support the public health workforce from the University of Montana. And what we did is we leveraged the existing Montana Public Health Training Center that we developed with funding from the Montana Healthcare Foundation and the State Health Department about a year ago. At that time, based on needs assessments, we identified regular public health training activities that we wanted to provide trainings on. That included things like program evaluation, introduction to epidemiology and statistics, budgeting, how to write grants. And at that time, we had a good plan, and we had several webinars and trainings that we rolled out. Our partners at the state on this are Alexis Tobin and Terry Ray, and then Emily Weiler here at the University of Montana is our training coordinator. We quickly figured out that we have an opportunity to reach out and support public health professionals across the state by conducting wellness trainings and other activities focused on mental health and resiliency using the platform created by the Montana Public Health Training Center. So very recently, we received additional funding from the State Health Department to create what's called the Wellness Care Package. And what it is developing some trainings and some health coaching opportunities to support very specifically the public health workforce in the state. We started out with a needs assessment that over 100 public health professionals across the state over the last couple of weeks have responded to. And that really helped us develop with what their feedback from the trenches of what types of activities and trainings and topics that they would like to focus on or hear more about. And then how would those trainings be delivered? Is it a 4-hour workshop? Is it a 30-minute session over lunch? And we're taking that feedback to kind of guide the next steps of this project. Working with the Curry Health Center, the wellness team at the University of Montana, Kaylee Julius, Lydia Check, and then Annie Sondag is a faculty member here in our school. We developed some ideas to do health coaching and implement that at the public health workforce level. So this item number 2, group health coaching for leadership. So we've been provided with the list of health department leads from the state health department, over 25 or 22 health departments that we will be working very closely with, bringing them as a group cohort and doing health coaching training to implement peer learning and overall well-being. So this is focused on the leadership, providing health coaching activities for leadership in these state health departments. Next thing that we're going to be rolling out is one-on-one health coaching sessions with health department staff. And the ideas that came up in the needs assessment as far as what type of things to focus on includes focusing on stress, work-life balance, resiliency, sleep, exercise, nutrition. So it's not just targeting mental health or stress. It's kind of the full service, looking at everything that kind of goes into anxiety and things that we could all do towards resiliency. Then the last thing that we will be implementing is rolling out a series of webinars that will target very specifically the public health workforce. So as far as next steps, the data that we continue to receive from these needs assessments from public health professionals across the state are helping inform what these wellness sessions look like. We will be implementing the group health coaching activities and also the one-on-one counseling activities with individual staff from throughout the state. Starting this week, emails are starting to go out and setting up appointments. And then as our job at the University of Montana, and especially our school, is to continue to advocate for public health professionals. Not only supporting the local health department in Missoula City County, who's done a fantastic job of keeping our community safe, but also the state health department and other entities across the state, providing the data, the science that will help inform policy and mitigation strategies. And then finally, this last point about promoting science and decision making. Science doesn't have to operate in a vacuum. It can be used in informing mitigation strategies and informing best practices. And I think that was evidenced by what Darren Lenga showed with her modeling. Like what happens when people wear masks and they social distance. And as you can see, there's a very clear relationship that if you do these mitigation strategies, that cases of COVID will go down. And we can all return back to the bars and to the restaurants and to normalcy quicker if we all adhere to policies and mitigation strategies, again, that are informed by science. So I'll close by showing this last logo from the National Association of County Health Officials. It's very simple. The role of public health is to prevent, promote, protect. Prevent, meaning that the public health is put in place to prevent diseases from happening with populations. Promote, we want to promote those best practices that will protect the health of our community members, our family members. And then protect. Our job as public health professionals is to protect the health of our communities. So with that, I'd like to just close and say thank you very much to the public health professionals and the workforce across the state of Montana. Your work is not going unnoticed, and we appreciate you as we do the healthcare workers. With that, I'll stop and take any questions.
Well, Tony, thank you so much for that. And thanks to all of you. What I really want to emphasize with our speakers today is truly, it's not an exaggeration to say that they are heroes that will be remembered beyond the pandemic. If you look at the professionals that we've been meeting with today, they've all had different priorities and different work that they've been doing over the years, and they've essentially dropped almost everything to protect and support Montanans in the pandemic. If you look at Dr. Simmons, her primary research emphasis is on the health effects of environmental exposures that are relevant to rural populations. But since March, she's headed up the epidemiology situation unit for the Missoula City County COVID-19 response. So again, I encourage you to look at the bios of our speakers today, all people that are doing incredibly important work in terms of environmental health, pollution and respiratory and cardiovascular health issues, but that they've essentially dropped the majority of that work as much as they can, or really doing two jobs, I should say, continuing to do that work and continuing to support the people of Montana. So looking at the questions, I know that Dr. Simmons has addressed a number of them. So I encourage you to look at the answered portion of the Q&A, but wanting to get to as many questions as possible in the next 13 or so minutes. That we've had a lot of people who justifiably are very interested in the vaccines, people who are interested in the different variants that are coming across, questions about opening schools and how we engage with classrooms in a time of distancing. So let me start with the issue of masking and distancing. We have David Parsons, for example, asking how we can emphasize the importance of keeping up practices of distancing and masking as more people are being vaccinated. Dr. Simmons did address a question on, let's see, the concern about restrictions being lessened and that it's important for us to continue as individuals to use masks and social distancing. Can one of our panelists speak a little bit to the importance of masking and distancing beyond what you've discussed so far, and how each of the participants here in our community can play a role in supporting those conditions?
I think Dr. Langa's model that really shows the importance of wearing masks. That it's quite possibly the easiest mitigation strategy that we have, that all of us can do. It is certainly an inconvenience. There's been some misinformation about buildup of carbon dioxide and within masks, but the science has shown that wearing masks dramatically reduces the chance of infection. As far as how do you get everybody to wear a mask, and unfortunately the issue has been politicized. But the goal is to get as many people as we possibly can to wear masks and just keep up with consistent messaging from the health department, from just infomercials, just reminders to your own family members to continue to wear masks when you're outdoors and in public.
Great. Thanks, Tony. We've had a couple of questions here that I'd like to address to Deshane in terms of Native impact. For example, sorry, and that might have been answered. Deshane, I don't know if you have seen those questions. What's happening with encouraging Native populations to take the vaccine? What kind of hesitancy are you seeing? And also the long-term impacts in these communities.
Yeah, that was just saw that, so I was typing, but I'll just give a quick answer here. So the sort of the steps that we're taking at All Nations are what I was talking about, that culturally tailored messaging. And so we put on our social media and out to the community as much as possible images of our staff, of elders, of Native people receiving the vaccine. And I think, and I actually was interviewed for an article in the Missoulian, but the message that I really put out there is that in the case of All Nations Health Center, our vaccine was being provided by a Native pharmacist. And so you had a Native woman pharmacist providing the vaccine to the Native community. And for so long, medicine and public health have been done to Native communities and not done for or with Native communities. And so really addressing that messaging that in this case, it's Native people are taking control of our public health and our medicine. And we are sending out that message that vaccines are essential for our population, particularly because we are disproportionately impacted by this pandemic and historically other pandemics. And there is the mistrust is going to take, it's very valid, and it's going to take a lot of time and work to move away from that distrust. It's also going to take a lot of accountability and holding national leadership accountable. And so what we do is we have national organizations, National Congress of American Indians, National Indian Health Board, National Council of Urban Indian Health are doing that work at the national level, sharing with us what they've done, and so that we can then give that message out to our community.
Thanks, Deshane. Let me move to the questions about schools. A couple of people here have asked about the possibility of school employees being moved up. They had been in 1B, they're back down to 1C. A number of other states across the country have prioritized their education frontline employees. And another question here, sorry, there's so many questions, I keep skipping around them. From Brett Taylor, in your opinion, is the impetus to completely reopen schools premature now that teachers have dropped down? Would one of our panelists be willing to address the issue of teachers, vaccinations, and the importance of opening schools? Any research you've seen in terms of bringing kids back?
I'll attempt to answer that question. As far as where teachers fall at this point, I won't comment on that. But as far as is it premature to have students go back to schools, it's a really complicated question. There's certainly, the mental health challenges of students not being in schools, and they become unengaged with schools if they're stuck at home. Nobody wants to have their kids take online classes. It's tough on the parents that also can't work sometimes. I think it's really important for students to go back into schools. That's where I think the science and paying attention to those mitigation strategies that work, and having the science kind of dictate what a safe distance classroom could look like. As we've seen here at the University of Montana, I think looking at the rates, it's kind of proved that you can have safe classrooms and do them effectively. And I suspect bringing the students back into the public schools, we can do the same thing. Of course, there's concerns with teachers being in classrooms with all the kids, and I think if there's just continue to employ those safe mitigation strategies, socially distanced classrooms, and having students mask up, and the teachers being socially distanced from the students as well. I think there's more benefits to do it that way than to have students continue to stay at home. And again, this is totally and completely in my opinion.
Okay, thanks, Tony. We've had a number of questions about the variants. I know that Dr. Simmons addressed that in the answered questions section, but worth a discussion now. How concerned are you of the other variants in terms of infection, deadly outcomes, also the impact of vaccinations? Generally, can you speak to the variants that have arrived in the US? And there was the comment that we don't believe they have arrived in Montana. Which of our panelists could take that one?
I can start. I don't have a good answer. In the latest information I shared in the Q&A indicated just that they haven't been detected yet, which, as we know, is not the same as them not being here. But I think there are, a number of things we wonder about with the variants. Are there transmitted more easily, which they appear to be? Are they are they associated with more severe disease or increased mortality, and will the vaccine work against them? I think those are the few of the things I think about. And I am encouraged by, the pharmaceutical companies, Pfizer, working on a booster to address the variant, that the vaccines appear to continue to be effective against them. But I would say, in summary, a short answer is I don't personally know the answer, but it's a question that I'm really looking forward to hearing Dr. Fauci's discussion of this. I've heard him in a number of press briefings talk about the variants, and I've always learned a lot, and and I think in a few weeks' time we'll know even more, and so it will be it'll be a treat to have him here talking with us about that and other things.
I might just add on a few words to that, Erin. Thanks for your answer. I think it's the unknowns about these new variants that just highlight how much we need to be, as individuals, continuing to wear masks and continuing to social distance, even with vaccine administration starting to ramp up a little bit. Vaccines, even if they're effective against the new variants, then they're not going to be an immediate answer either. It's going to be months in the making. So there's just a lot of personal responsibility, regardless of county or statewide restrictions. A lot of responsibility on all of us to just stay diligent and keep those personal restrictions in place.
Thanks, Ethan. There are a number of questions here about the legislature. We just have a few more minutes to go, and I'm not sure that actually anyone among us is tracking those. Of course, the University of Montana does have people working with the legislature. We work with the Office of the Commissioner on Higher Education on a lot of these issues, but I wonder if any of our panelists could address any of these questions in terms of impacts of the proposed $1 billion cut to the department, comments regarding Bill 121, and just anything else that might have come up regarding the legislature.
Well, obviously we're in a pandemic, and I think any efforts to undercut public health funding or mitigation efforts or local public health authority to protect the health of their communities is not the best idea at this point in time. And I will stop there, but there will definitely be adverse impacts to populations, into public health programs that are tasked and mandated to keep communities safe. If there's any reduction in funding or any legislation that undermines those efforts.
Well, great, thank you. With that, Tony, I just want to highlight a couple of the comments here. Catherine noted, as a retired academic and organizational development professional, your wellness care package is top-notch. Consider conducting program evaluations so this could be replicated and shared with others. Well done. Thanks to that, kudos to the team here. They have been doing tremendous work. I know that someone asked for the web link to the Play Pandemic tonight. I'm not sure if someone could drop that in the Q&A box. But I just want to thank the faculty and students who joined us today, sharing the critical work that they're doing to keep Montana healthy and safe. Thanks to UM's Alex Karklins in particular for his technology support to have you all join us today, and to our team at the Mansfield Center, Randy Edwards, Daphne Felker, Betta Leon Del Sordo, Mariah Thomas, Heidi Blair, and many others work together to work with our communities across Montana and ensure that we have dialogues that are of interest to all of you. So please join us next Wednesday. We have our next pandemic dialogue on the disproportionate impacts of COVID on Native populations that will be moderated by the founder of We Are Montana, Cora Newman, and feature the chairwoman of the Confederated Salish and Kootenai Tribes, Shelley R. Fyant, and a tribal council member from Fort Peck, Casey Willett. So that brings us to the conclusion of our program today. We want to thank you for joining the Mansfield Center and hope that you all stay safe and healthy. Good afternoon.